All right, I'll just take a couple minutes. There we go. Just take a couple of minutes, then hand it off to the other folks. So, Jon Levy, I'm professor and chair of the Environmental Health Department at BU School of Public Health. And as Natalie mentioned, I'm an associate editor at AGPH, kind of with a section focus on climate change and health equity. And so with my colleague Diana Hernandez from Columbia, we organized this special section that was published in January, which is called New Frontiers in Environmental Justice, or something to that effect. The goal just kind of broadly to look at where the field is and where it's going, and some exciting areas in research, practice, and education ideally. And when the article by Carly Levy and colleague, no relation, was submitted, it really fit nicely here because it really spoke to what is the next generation of public health practitioners learning about environmental health and about environmental justice, and where are there some gaps in whether CEF accreditation criteria or broadly how schools are implementing that. So when that article made it through the process and was accepted, we solicited 2 different commentaries on it just to give additional perspectives and framings on what we thought was a fairly important topic. So one of them that Barbara Turpin here was the lead author on, and I was involved in as well, assembled department chairs from 9 or so schools of public health around the country just to reflect on, or I should say environmental health department chairs to reflect on how our experiences have been in recent years and what our thoughts were. And then of course T wrote another excellent editorial that extended, or commentary I should say, that extended the discussion and brought in topics of sustainability. So that's the context. Probably should let the authors speak for themselves. I'll happily jump in as needed on the discussion on the chair's commentary. But I don't know, should we maybe give it to Carly next as the lead author on the primary article?
Sure, perfect. Thank you. Nice segue. Go for it. Carly, if you'll introduce yourself a little bit as well. Thank you.
Absolutely. Thanks, John. And I don't know if you noticed, but he put on his Twitter chat when he was discussing the article that we are not related, even though we have the same last name.
No nepotism there.
Yeah. I just wanted to introduce myself. So I'm the director of the MPH program at the Massachusetts College of Pharmacy and Health Sciences. And I've been a member of the board of APTR, which is the Association for Prevention, Teaching, and Research, for about 6 years. And we have a working group on environmental health, and we've done a few things. We created an educational toolkit on climate change, and we've been having a number of discussions on environmental health education. And I first have to apologize because it took us 5 years to write this article. This is something we were talking about, ever since the criteria came out. And we've had numerous conversations with CEF about what we felt were, limitations in the competencies. And it's actually why CEF started collecting those data on trends in environmental health. So I'm going to throw a link in the chat that was sort of an inspiration for this article, because in our conversations with CEF, they started collecting data on whether or not schools and programs in public health were reducing their concentrations and or content related to environmental health based on the new competencies, which we said they probably are. And then the other, concern that we had that, sort of forced our hand in writing the article was under no uncertain terms, CEF had said very clearly that they would not do anything with the competencies at this revision of the criteria. They said this revision of the criteria were going to be procedural only. They weren't open to adding any competencies or, changing the competencies in any way until they collected some data on it. They said, at the 5-year mark, they sort of wordsmith, and at the 10-year, that's when they do a real, sort of shakeup of the criteria. So we were disappointed, and we said, okay, well, this is unfortunate, but okay, we'll work with that. So we wanted to write this article to sort of frame the issue that we're concerned about these new criteria. Is it impacting, schools and programs in the way that we think it is? And then also to sort of showcase some other efforts to kind of juxtaposition it with, the CEF criteria and how it might have been a misstep. So as an example, the Public Health Accreditation Board has a lot of, content related to environmental health in the accreditation of health boards. And the National Board of Public Health Examiners in the CPH exam, although it's limited, there is content related to environmental health. So we were saying, and then the three of them wrote an article that we cited in our paper, sort of comparing and contrasting what Public Health Board is doing versus National Board of Public Health Examiners and CEF. And so we thought that that was sort of a missed opportunity, because there's a very clear chart that shows that CEF has no competencies related to environmental health, while the other organizations do have competencies related to environmental health. So I kind of thought this was sort of a obvious, thing that while the health boards are all, still have content, and the CPH exam still has content, but yet CEF has no competencies. And then they also said that, well, you can apply environmental health content to some of the competencies like planning and management and policy and things like that. And we just said, well, I just don't think that's good enough. So that was sort of the inspiration for our article is, yes, schools and programs could continue to, take their environmental health courses and, create assignments around that content that would meet some of the competencies in policy and things like that. But, our sort of call to action is, even though there's not an explicit competency related to environmental health, schools and programs not only need to keep any content that they have in environmental health, but then also our advice is to expand it. And so our next steps would be, can we create tools for schools and programs of public health who maybe don't have, experts in environmental health, that they could insert things into their curricula? Could we create educational modules that people could just insert into courses? Could we create, almost like certificate opportunities, and when I say certificate, I mean like sort of micro certificate, like, you take a 3-hour course and you get a certificate in this. Could we create those types of opportunities and digital badges and things like that schools and programs could just use? So that's sort of our next step from the article is, could we create things that schools and programs could utilize in their own curricula? So I'll turn it over to the co-authors on the department chairs article. Thanks for the opportunity.
Great, thank you, Carly. I'm Barb Turpin. I know some of you, but not all of you. So let me just introduce myself. I'm the chair of the Department of Environmental Sciences and Engineering, and ESE was a founding department of the Gilling School of Global Public Health at UNC 80 years ago. And so we serve the role as the department that works on solutions to environmental health challenges at Gillings. So I'm one of 9 or 10 chairs of environmental health departments that have been meeting somewhat regularly to talk about common things, right? And we saw this article that Carly led as an opportunity to weigh in. I think it was a very useful article, and we agree that the recent revisions in the CEF accreditation criteria seem to have a negative impact on environmental health preparation of public health professionals. And so I think our article reinforces that, says we think that there's never been a more important time for such an education. And I think what we thought would be a useful maybe clarification or addition that we could provide in our article is around methods. And I can say I've heard this. We have some cross-cutting MPH concentrations, and so I've been interacting more with faculty from other departments, and they'll say, they'll talk about environmental health as an application, but not as having methods. And when I heard that, I think it sort of, I had an aha moment. And I think, our discussion as chairs sort of reinforced that idea. So we wanted to make the point that public health professionals need to learn foundational tools or foundational methods of environmental health that are used to mitigate the deleterious effects of exposures. And so, then people ask, well, what are those? And I think it is a somewhat common problem that not everybody in public health has been trained in those methods. So they don't know what they are. And so we tried to articulate what they are, but I think we need to keep working at that, being more clear. And, one of those is, can you conduct an environmental risk assessment derived from dose response and exposure estimates? The kind of thing that's used in the WHO global burden of disease estimates, or to inform EPA's standard setting process. Those are tools that we use to prioritize the problems that are most important to solve. Can you perform an exposure assessment to link exposures to their sources and enable effective risk mitigation? What's the origin of that high blood lead in the babies in a community, for example? And can you understand how to think about uncertainties in measurements? Because that's an important part of that. Can you construct a simple, now maybe this is, well, no, this is, I think also part of it, but can you construct a simple compartment model based on conservation of mass or energy to predict, for example, the concentration of dose of aerosol-borne COVID and how it's affected by ventilation and masking and time spent indoors? These simple physical predictive models can be used to design effective risk mitigation strategies for chemical and microbial risks, and to understand and communicate about climate change, for example. And they serve as the foundation for more sophisticated predictive modeling upon which environmental policy decisions are made. And, when you're working with those, then of course you have to understand how to think about uncertainties in models. So I think, we think that some foundational ability to apply these methods is important to all public health professionals, not just those specializing in environmental health. And especially these days as we face increasing threats from climate change and other kinds of environmental change with consequences that exacerbate health inequities. So I think that's what we're trying to get across. And I must say, I sent our article to our associate dean for academics, and she maybe still needed me to explain. There wasn't enough detail in the paper to explain what did I mean by methods. She didn't recognize the word. So I think there's some education we need to do for the last generation of public health professionals so that they understand what we're saying.
Thanks, Barbara. John, did you want to add anything as a co-author of that piece and those conversations?
Not really. I think Barbara covered the bases. As a reinforcing point, again, as we wrote, and I think all the authors wrote, the challenges of our time, like climate change or COVID or others, involve environmental health skills. And I think it's become just increasingly apparent. And certainly, there's another commentary and discussion that we had that, people working in the field of environmental health or air pollution, right? Some of these novel, discoveries related to COVID were not surprises to people with environmental health training, right? The fact that an indoor source, does not disperse as readily as an outdoor source, and that ventilation and filtration matter, and that you can, filtration depends on particle size. None of these things were shocking because they're all based on first principles that you learn in environmental health. And so, you could certainly do the thought experiment of if people working in the field of public health dealing with pandemic response had that foundational knowledge, had the ability to do, compartment model like Barbara said, or just understood these core concepts, where would we be today versus where we are today? And, and you can look at certainly countries that have had a more robust pandemic response are ones that quickly understood what it means to have something airborne and how important it is to have exposure reduction strategy in place. Like look at the 3 C's strategy in Japan, for example. So to me, it just reinforces that, dealing with these pressing issues over time, right? There are fundamental skill sets in environmental health that students are walking out the door of schools of public health not knowing. And so we're not preparing our students for the problems they're going to be facing.
Great examples. Thank you. Thank you. Thank you. T, I know you have some thoughts on this, and when I invited you, you were quick to respond, and I'm excited to hear, because I think it's front of mind for you and you care a lot about this topic. So please share some of the highlights of your paper and beyond.
Sure, it is very much front of mind. I put some notes about my background in the chat. I won't repeat them. I think that that this represents a really important sort of critical point, because I think for many years that public health has become sort of unmoored from its traditional foundation. Public health began, it started with environmental health. Since 1850, that was the bedrock. That was where the field began, and it was very technical, and it was very much associated with hazard. I think that what has happened is that since about 1970 and accelerating after that, there's been a gradual transition in the focus and the concern of public health educational leaders, not public health leaders, educational leaders, to move away from that sort of technical complexity and concreteness part, and toward a behavioral focus with particularly with the advent of health promotion, but not only because of that. Global health has also played a role in this, so that the focus has been on a different set of methods, a different set of public health problems, and the exposure response, bacteriological, virological, toxicological focus that was traditionally environmental health has been marginalized, and it's been marginalized in large part because it doesn't fit at least it doesn't easily appear to fit the health promotion model. Now, the health promotion model gives tools for changing things, but not on a collective basis. Notwithstanding the Ottawa Charter, health promotion really doesn't provide a blueprint for say, building an environmental health department. It provides a blueprint for modifying, for collectively modifying societal risk and behavior. And in that sense, we're where public health was, and not where it saw itself as going over the last several years. It's simply the technical content and the problems associated with environmental health simply don't lend themselves easily to the current predominant paradigm of public health. And so, rather than come to grips with it and actually deal with it, we're sort of shoved aside with because the other is frankly easier. And as you know, running environmental health departments cheaper and attracts many more students. I know that in my former institution, I'm retired now, but at my former institution, it was global health that was paying the bills. That's where the big tuition revenue was. And then they graduated and were competing with other MPH for local jobs because there simply weren't enough global health jobs on a really global scale. So they're to some degree we're a victim of structural problems, but also because we're difficult to put into a box. Now we're there are methodological issues, been said before, that are different. For example, the primacy of primary prevention in environmental health. Once you get, there isn't, most of environmental health is primary prevention. When you get into secondary prevention and other aspects of it, we don't relate nearly as much. So we have much less in common with some of the other issues, and certainly very much in terms of health policy, where we're an outlier. So we don't fit into the public health curriculum so easily. What we do requires collective action. There's really no good way of enforcing a standard by voluntary initiative. You can't change health behavior on an individual basis and expect to solve problems of water pollution. And we've just seen how difficult it is to make a dent in something like COVID. So we have a problem here in that we are now not fitting very well in the curriculum. We also have a problem in that our big existential problem staring us in the face of climate change doesn't fit the paradigm that we're accustomed to, in the sense that it's not fundamentally a problem of the source exposure effect model. It's fundamentally a problem of ecosystem change and multifactorial models. We need to come to grips with that and change our curriculum as well, and also include part of a socio-technical component into the technical environmental health part, in order to be change agents more broadly, not all individual behavior, but also with regard to societal behavior, in order to deal with these big, overwhelming ecosystem scale problems. Because environmental health now is about wicked problems in the technical sense. It's not so much about individual problems and individual solutions as it is big, complex, multifactorial problems. And part of that that's part of the reason why I invited Julie Zwickel to be a co-author, and she contributed heavily, because she's a social epidemiologist and sees that part of it as being fundamentally. And we had already written 2 editorials together. I think that this is an existential moment in environmental health. And I think that we should also be reaching out to other organizations and schools of thought. I've done a lot of work in the last several years with the Association for Environmental Studies and Sciences. These people are afraid of health. They're petrified of health, because they know that if they make a mistake, the stakes are enormous. So the environmental studies and environmental sciences communities has been very reticent to get involved in issues of health. I think that we need to build a bridge there. And I think that's part of the agenda for the future. So those are my thoughts, and a capsule of what I wrote in my contribution.
There's a lot from all 4 of you that was just shared that I think can really push our thinking in these conversations. I'm going to stop the recording now so we can just open up an open dialogue.